Hello, I'm Dr. David Green, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today we're discussing avoiding back surgery in the 21st century. Back pain is rampant these days. Over a million people today are in bed due to back pain. It costs society over $100 billion a year, and that's including both the direct and indirect cost. Some studies show that it's much higher. There's over 400,000 spinal fusion surgeries done each year now in the United States, and that is a 15-fold increase over the last 10 years. Most back surgery, by and large, is elective and is done as a quality of life procedure. There's only a few absolute indications for back surgery. One would be cauda equina syndrome, which needs to be done right away. Unstable fractures, like after a car accident, if you break your back, some bones, they can be unstable, need to be fixed immediately. Or if a patient has having progressive neurologic deficits, such as the nerves being pinched and they're losing motor function, it's not absolute, it's more relative, but I put it here because it's not elective. That would need to be heavily considered. Elective back surgery is what most surgery is done for in this country, and that includes things like degenerative disc disease, which you can see here with the dark disc as opposed to the others being nice and white. That can lead to some pain and some issues. Spinal stenosis is another thing that can cause some back pain when it has arthritis associated with it. Maybe a what they call degenerative spondylolisthesis, where one vertebrae slips a little bit on another. So because these are quality of life elective issues, you really should exhaust conservative treatments prior to undergoing surgery. Is there a magic treatment to avoid surgery? Unfortunately, there's not. There's no gimmicks. There's no snake oil liniment. There's no holy grail. The treatments that we're talking about here are real treatments. Activity modification, physical therapy, chiropractic treatment, medication management, interventional pain management procedures, spinal decompression therapy, TENS units or spinal bracing, and then manipulation under anesthesia. I'm just going to run through these briefly and show you some of the options available. Activity modification. It means if it hurts, just don't do it, or do something else. So if you're jogging and it's causing pain in your back, that is a high stress activity. So switch over to swimming or cycling or something that's not going to put the stresses there. Benign neglect just refers to ignoring the pain. If it's tolerable and it's not really debilitating, just ignore it. I mean, most of the time, the vast majority of the time, ignoring it's not going to cause you any harm. So just wait until it becomes necessary to truly address it. Physical therapy can strengthen the muscles around the low back. Those are called the paraspinal muscles and take pressure off the painful areas. A number of studies have shown that aerobic exercise can give excellent results, and it might be the single best activity for degenerative disc pain. It might be necessary to have interventional treatments like injections, like trigger points or whatnot, before physical therapy to make sure you're able to do, especially if you're having an acute exacerbation of pain. Chiropractic treatment is now more mainstream. About 10% of the population is under the treatment of a chiropractor at any one point in time. More insurance companies are covering it, and the reason is because there's more research coming out showing that it works, especially for acute pain in the low back. It works better than a lot of other, even medications. Medications, speaking of, there's a lot of them. Chronic narcotics should be avoided for back pain, if at all possible. And the reason is that they have side effects. They have side effects of depression, constipation, tolerance, means you need to take more medication to get the same desired effect, and addiction. So all those can result and leave the patient in a worse situation they were in before. So it's better to start with things like nonsteroidal anti-inflammatories, Tylenol, just stay within the manufacturer's dose, and you can take those on a little bit more of a chronic basis. There's also some patches you can see in the picture, a lidoderm patch that can be put on the low back that kind of seeps in some pain medication through the skin. Muscle relaxers are very good for acute short-term issues. Neurontin and Lyrica are being used more often for pain control in the low back. They can work very well. Tramadol is Ultram. That is a non-narcotic analgesic that's non-addictive, so it can be extremely effective to avoid the problems with opiates. And then it's best to use medications along with the comprehensive pain management program with the modalities we're discussing, PT, chiropractic, interventional. That way you're not just throwing pills at the problem. And that's what's so easy, right? Is when you go in to see a doctor, they just give you a prescription for pain medication. It'd be nice to avoid that to help really get you more functional for the long term, and you can have less side effects as well. Interventional pain procedures, we'll just sort of skim through these. I didn't put trigger point injections on here, but that should be added. Facet injections are the most common pain management interventional procedure in the United States by far. They go into the joint. You can see a picture of one here with the needle going into the facet joint. If you have one arthritic joint, you probably have three or four, which is why it's the most common procedure, is because there's multiple joints usually being injected. Cortisone is the typical substance. It doesn't fix anything, but it can give a lot of pain relief for weeks to months. You can also, there's some new regenerative substances that contain some stem cells and cytokines, anti-inflammatory things that are non-steroidal. Those are becoming more popular. We have that option at Preferred Pain Center. Medial branch blocks is basically doing the same type of injection, but not in the joint, sort of around it to get those little nerve endings that are providing pain to the joint. If those work and they wear off, one of the best procedures on the market right now is radiofrequency ablation. And that will burn those little nerve endings that can give upwards of 2 years of pain relief. Procedures that are into the disc, intradiscal things, discograms, those are being shown to potentially cause disc degeneration, so there's a lot less of those being performed. There's some exotic procedures, minimally invasive lumbar decompression or RACs, RACZ catheters. I'm not going to discuss those. They can help, but they're just not very commonly performed. And then spinal cord stimulation. That is a last resort, minimally invasive procedure that can put a paddle over the spinal cord and emit little electrical impulses and help significantly with back pain that is not amenable to surgery or failed surgery. Spinal decompression therapy was FDA cleared back in 1996. It's become immensely popular. We have this at Preferred Pain Center, although a different table than what you see in the picture. It's low risk, it's affordable, it's very effective for the following. It's back pain, sciatica, facet arthritis, spinal stenosis, bulging or herniated discs, or failed back surgery that did not involve screws or rods. So it can really help in conjunction with some of the rehab, the chiropractic that also is offered, and help avoid surgery. TENS units are small iPod-looking devices. There's battery powered. That you can put them on your belt, and then the electrodes with the sticky part go on your skin. A little electrical impulse gets emitted, and it can help with pain control. It doesn't fix anything, but it can suppress pain. And if used intermittently, can be very effective at decreasing the amount of medications you need, allowing you to work and function and do things like that, which are can make all the difference in avoiding surgery. Bracing can be very effective for short-term pain relief. It basically acts as a splint. You have a wrist fracture or a wrist sprain, a splint can help minimize the motion and keep it comfortable. Same thing, you just don't want to wear them long-term because it's important to use those back muscles to keep them there, otherwise they'll get deconditioned and atrophy. MUA is manipulation under anesthesia. It's becoming more popular these days in the chiropractic community. It involves a procedure for 3 consecutive days. You have anesthesia and 2 doctors manipulate your back or pelvis and can give a lot of pain relief, and it can help you avoid true surgery. So if you need more information, just call our office and we'll get you in and talk about it. But our office was named Best Chiropractor in Phoenix 2010, so they're extremely effective in this, decompression, manipulation. With these 8 non-surgical treatment options, over 95% of back pain patients are able to avoid surgery, and that's impressive. Our office offers all of them. We are a comprehensive pain center in Arizona. Call us at 602-507-6550. Lots of information, educational videos, articles on our website and our blog at preferredpaincenter.com. New pain patients get a free massage, and we guarantee you will get your treatment started within 24 business hours. I'm Dr. David Green, Preferred Pain Center. Your pain stops here.